Thank you, Frank. Okay, so at this point of the day, I think that just about everything that could be said has been said in multiple different ways, so I'm going to try a completely different view, and I hope it makes sense or is at least entertaining. So let me start from way out in left field, or the Star Trek reference, another galaxy, which is, as a life scientist, I believe that we are entering the third great age of life science research. The first age being the one of description and classification that started with Aristotle and went through Linnaeus. The second being reductionist, mechanistic biology, really understanding at a deep molecular level how things work. And that started with Darwin and ended in about 2000. And now we're in the age where we're putting that reductionist information together so that we can really start to understand emergent properties. And this is the systems biology era. And I think a lot of people are under the impression that that systems biology area has been driven by biotechnology, and it has been, but it's also even more so been driven by the revolution in computational power. And so what I want to talk about is computational power, its promises in environmental health and toxicology, because that's where I live, and the challenge, which is, the challenge is that in order to make systems biology approaches or computational toxicology or computational approaches in general work, these things are incredibly hungry for data. And so on this slide, if you're a toxicologist, I put up some questions that we'd like to answer, and they'll resonate. If you're not a toxicologist, I'm not going to belabor them, but the main point is the need for data. Next slide. So one of the things that we've done over the past 10 to 12 years is to try to see what we can do on a large scale to make sense of all of the individual toxicology studies that have ever been conducted. And so what we've done is put together a relational database that can be searched by chemical structure or chemical substructure, so that we can do things like try to propose an understanding of the toxicity of a new chemical based on analogy to chemicals that have already been tested, and also to try and get a handle on what is the universe of modes of action, or what is the universe of structural features of chemicals that convey some sort of hazard. And these have been unanswerable questions, and because the boundaries of this are dark and fuzzy, we've always just thought, well, there's no alternative other than to continue to test and test chemical by chemical and live with the uncertainties that that has. So what I wanted to convey by this slide is to simply say, for a large number of toxicity endpoints, there's actually a great deal of information, and so the numbers in parentheses behind each of these toxicity endpoints is actually the number of entries that we have in our database of individual studies on various chemicals. And so you can see that there's actually a wealth of information out there. This is both from the published literature and what we can get out of the gray literature. So things like, and what I mean by gray literature are things that are available from various government agencies usually, so the TOSCATS database from EPA, or now the REACH database. So next slide. So some of the things that you can do with this kind of information are to put together a decision tree, and I think I realize at first glance that this looks hopelessly complicated, which is fine because I'm not going to walk you through it. But in reality, there's a simplicity that arises from this, which is we took about 800 or so developmental toxicants, and these are represented by multiple studies. So a pretty good fraction of the literature that's out there, and put together a decision tree that's based largely on chemical structural features, but could also be conveyed as putative modes of action for toxicity, for reproductive or developmental toxicants. And the simplicity of this is that for a toxicity as complicated as this one, we can break this down into essentially 25 groups of chemical features. Now, some of these are more complicated than just 25 features, but I think what you can see is we can start to get our arms around with these computational approaches things that were not feasible before. And so, one thing we can do with this is simply say for any individual chemical, whether there's any precedent in the literature for something with similar chemistry, for it to be a developmental or reproductive toxicant or not, which is, I think, a valuable piece of information. But more importantly, we can start to put together ontologies for modes of action of toxicity, which organizes the field in a way that hasn't before and allows us, or more importantly, allows regulatory agencies that are responsible for public health to really start to understand which of the tens of thousands of chemicals that we don't seem to have a lot of information for should be prioritized most highly for more information, and which ones probably aren't of great concern. So, I just put these slides up as an example that you might not have seen before, such that you'll see something different by the end of the day here. But the point that I really want to bring from this is, in order to do these kinds of approaches, or in order to do toxicogenomic kinds of analyses about modes of action, these are really data-hungry exercises. So I guess my point is that the sharing of data, at least from where I sit, is more valuable than retaining the data. And I realize that others have a different calculus from where they sit. But the question is, that I think is most important now is, what do we mean by data? And I think that for this kind of information, what we really need are data summaries. As Greg Bond pointed out earlier, a lot of this data is generated with a common protocol. The data are analyzed in essentially the same sorts of statistical ways. And so summary statistics are probably the most important. And I can also tell you that having gone through the process of compiling the database that I've told you about, and EPA has done this similarly, a similar database, is that this takes man-years worth of effort. Doing this ontology or doing this decision tree that you see here also takes man-years worth of effort. And that effort is only compounded if we would have had to start from raw data rather than some sort of summarized data. So for these purposes, and I think as a general principle, what you want to do is start with the most refined and processed data that you can use, that you can live with, because it saves you time. And so, think about what the question is. For other purposes, like genomic analyses, where we're still feeling our way through what the protocol should be for those things and how to analyze data, how to normalize data, in those sorts of situations, I think that raw data is probably also valuable to share, but probably not an exclusion to the refined data. And in fact, what we have decided as a field is that those data must be submitted, and I think virtually every journal that I'm familiar with adheres to this. Those kinds of raw data must be submitted in a public repository in order for a paper to be considered for publication, not just after it's published. So that's what I wanted to say about my view of data sharing, and I hope I've just given you some food for thought for the discussion. Thanks.